would like to call next speaker, Dr. Sitalakshmi. Sitalakshmi madam is a gynecologist and sexual medicine practitioner. She's an innovator of Dr. Sita's batch therapy, which she's really going to speak on today.
Sitalakshmi, and it's an honor to be here today. Thank you to the organizers for inviting me. As sexual medicine practitioners, it's not enough if we just treat sexual dysfunctions. It's our duty to help our patients move from dysfunctions towards positive sexual health, isn't it?
Yes.
Yes or no?
Yes.
So I'm skipping the introduction, many slides because of lack of time. So today I'll be talking only practical points and only about our experiences, no theory at all. So during and before COVID, many people with sexual issues started reaching out to me after watching my educational videos about masturbation, about vaginismus and all such stuff. So initially most of the couples who approached me suffered from vaginismus, primarily because they wanted to conceive but have not yet consummated their marriage, and because I'm a gynecologist, obviously I was their first choice. So for my cases, simple counseling and guidance were sufficient and I used to give that. For moderate to severe cases, we implemented pelvic floor therapy, thigh exercises and vaginal insertion of fingers and later dilators. So I must have treated about 150 to 200 patients during that 2 years, The treatments ranging from 10 weeks to 5 months on an outpatient basis. Though I didn't always track the success rate closely at that time, it was around 50 to 60% patients, and many patients did not follow at all. But I was very happy, because at least I could achieve this much success rate. And over time, patients with other issues like desire, arousal, orgasm difficulties, ED, PE also started coming in. I continued learning and expanding my knowledge to manage these cases better. In the last 2 years, we have been conducting an inpatient therapy in batches, which has had transformative effects on our patients. We treat couples with vaginismus, erectile dysfunction and both conditions combined. We also handle cases where the couples have severe discrepancies in sexual life, those who have children but no sexual intimacy. They might have got a child through IVF or maybe through splash pregnancy or through IUI, and couples who are struggling due to unresolved issues between the partners. So since December 2022, we have conducted 13 batches treating 82 couples. Can you believe it? In just 2 years, 82 couples inpatient. And primarily for vaginismus, out of them were 50 couples, and primary erectile dysfunction, 15 couples. And 5 had both vaginismus and primary erectile dysfunction. And in 12 couples, the man had secondary erectile dysfunction. And 3 couples who came to us have got kids, and another one is coming in November. And I was surprised that out of the 82 couples, 53 had love marriages. It was very difficult for me to believe that, but that is the truth. And 25 have been married for more than 7 years, with more than 9 being married for more than 10 years. And here is some more data. I am not going to go into it because of lack of time. So regarding my initial admission therapy, it all started with a challenging case in mid-2022, which laid the groundwork for my current approach. So in mid-2022, a staff nurse couple from UK who were on 4 weeks leave requested me to admit them and cure them of the mammoth problem in their life, vaginismus. I was unsure if such severe vaginismus that they had could be managed in such a short time. I know that some of the slides are repetitive from the Sex Positive Summit we had recently in Delhi, but please bear with me, I have modified many slides, and so please don't go to sleep, okay? Is any of you sleeping? No, no? Yes. So I tried my level best to dissuade them, citing numerous excuses. I told them that I always develop laryngitis in the month of August, and I told them that in case they get admitted and if they are not successful, I am not going to refund their money. I cited numerous excuses, but they insisted that they want treatment from me because they had so much trust just by watching my videos. So with a sigh, I started developing a plan, read extensively, made notes. At that time, I did not know many of the, none of the eminent sexologists in this country. I knew only Neelima. But even she didn't have any clue as to what to tell me, how to guide me for in-house management. By the time Raju and Viva arrived, I was looking haggard due to loss of sleep. I had actus ulcers in my mouth. The responsibility was huge because of their complete trust. I was very transparent with them about the challenges, about them being my first inpatient couple, that I can't guarantee success, etc., etc. We reassured each other. And we even did breathing exercises together as part of the treatment because I was more tense than them. But with each passing day, things got better. And by the end of first week, they have made significant progress and they motivated other patients too who were consulting me during the time period they were there. And on the 17th day, they were able to consummate their marriage. And our entire clinic rejoiced. We were so happy. Actually, on that day, in the early morning, many of our staff went to the temple, nearby temple, to do mannat. So that's success. And so from day 15 onwards, every day, all the staff, the moment they entered the hospital, they used to ask, in Malayalam, I'm talking, that's local language. Yeah, avade sheriyayo. Is it done? Is it okay? Is it okay? So the entire staff also got desensitized to, they were also able to talk openly about all these things. And encouraged by this success, other couples also began requesting admission therapy. However, I was careful about whom I selected because I was scared whether I would be able to replicate this results with other couples also. Soon, another couple who had both vaginismus and erectile dysfunction also succeeded after 20 days of treatment, and my confidence started to grow. Word spread that we were not just dealing with sexual issues, but were educating couples on other important aspects of life. And so, more couples sought admission. So to accommodate the demand, we started batch therapy, which turned out to be the most effective approach and a game changer. So we transformed our hospital into a dedicated space for couple therapy, ensuring privacy and a supportive environment where the couples feel safe, understood and respected. And that is very, very important. When you deal with any person who has got sexual health issues, the person must be made to feel safe, understood and respected. I'm sure all of you will agree. Yes or no?
Yes.
So the group therapy sessions became the crux of our treatment as couples found comfort in knowing that others also shared their challenges. So from December 2022 to August 2024, we have had 13 batches and 82 couples. And we have got more than 50 couples who are waiting for admission in the next 6 to 8 months. We have got a long waiting period these days. And average duration of our treatment is around 16 to 17 days. And success rate at the time of discharge has been consistently 100% with regards to ability to have penetrative sex with confidence, with regards to the ability to do sensate, focus and enjoy it too, ability to arouse and get aroused, alleviation of the anxiety related to pain, erection, PME, etc. I made this modification after getting a suggestion from Rao-sir last time. And we ensure this. How do we ensure that we get 100% success at the time of discharge? By doing careful selection of couples, ensuring that they are ready for therapy. So we are also collecting data for research purpose. But also the selection process is currently biased towards couple we believe will succeed. Right now we are taking in only couples who are optimized for success. So how do we do that? Because we do that with the acknowledgement, that is our selection process acknowledges that sexual intimacy cannot be created in isolation. We take detailed histories and ensure that physical, mental and relationship qualities are addressed to a reasonable extent before admission. I am not going to go into the details because of lack of time. And before admissions, nutraceuticals, aphrodisiacs, vitamins, etc. are given. Some really help, but some just have placebo effect. And medications are given as needed to ensure that the woman doesn't get a period during the treatment time. That's also very important. We also introduce batchmates to each other via group calls to build familiarity. And another very important thing that we do is to build, we have started to build a community, because each of the new person who is getting consultation, they get the reference number of one or more couples who have had treatment from our center so that they can talk to them and they can gain more information and their confidence level grow. And after admission, the first group session is very important, I always feel. I emphasize on the aims and goals of our treatment program and the take-home messages that they need to understand on the day one itself and set the ground so that their willingness and commitment to follow our suggestions will increase. And I request all of you to please listen carefully to the next few slides. And the take-home message one that I give them is, even if one of the partner has a problem, be it related to sex or anything else, if both reach in and solve it, the results are faster and long lasting. And the bonding increases between the partners. Thus, they are in readiness, well, at least to some extent, to do the structured exercises that we have planned for them in a way that almost all of them have to be done by both the partners or with one supporting the other. And the take-home message too that I give is, it's a good thing that they develop whatever sexual issues that they have for. Because of that, they're getting the opportunity to learn so many things and come in a batch and get knowledge about so many things. And whenever they face any serious issues in life in the future, which we all know that all of us will face, no in married life, so they must remember how problems can be an important opportunity to learn new things. So this makes them start to think more positively right from day one and not to moan about their situation. And the take-home message 3, sex. Though it's very important in a married life, there are very different dimensions of couple relationship, and proper prioritization of each and every aspect is very important. This understanding on day one itself helps and motivates them to participate in group classes and interactive sessions we have on communication skills, conflict management, and understanding and speaking one's own and the partner's love languages, learning to set boundaries, which is very important, which many of us don't know how to do. The list is endless. All the couples absolutely love the group sessions. They don't feel, why we are doing all these things? We have come here just to do intercourse. So we set the ground for all these things. And the take-home message 4 is, sex is not for just having a child and putting a stop to the questions of the people in the society. That's what happens in our country. So sex is indeed a very important aspect of marriage and confers numerous physical, mental and emotional health benefits to the individual and also increases the bonding between the partners. And to get these benefits, intercourse is not the most important thing. There are many other things which are more important than intercourse to ensure a satisfactory sexual life. When I explain this to them with the help of some analogs and metaphors, though disbelieving initially, they become eager to learn the meaning of the things that we try to teach them. I am not going to explain the metaphors here due to lack of time. And take a message 5. That is to decrease the anxiety of the couples, whether they will get individual attention in the midst of a batch treatment. See, many couples, tell us, doctor, we are coming in a batch, so what will happen to the individual issues which I have? Will it get addressed or will your attention get diluted? Sir, can you give me just 2 or 3 minutes? Okay. So we assured them on day one itself that even if the therapy is being done in a batch and almost 95 to 98% of treatment measures are the same for all the couples, regardless of the issues they are facing, that all couples will give individual attention to. This is very reassuring to them and they relax and open up, helping us to guide them toward a positive outcome. Take home message 6. We need not be serious at all the time while we are tackling any major problem in life, be it sex or anything else. When we take the time out to relax, enjoy and chill, we can achieve our goals faster. Thus, they are open to doing a lot of musty and having fun. And it actually helps because at the end of it all, they feel they have had a holiday and amidst them, some treatment has happened magically. So the core principles of treatment involve self-love and acceptance, partner love and acceptance, improving physical mental health, enhancing intimacy through sensory focus exercises, psychosexual education, group therapy. The list of activities we do is here. I'm not going to go into the details. The couples are open to having psychosexual education together rather than having a ladies or gents only session after 3 to 4 days or even earlier. It's amazing, Sensory focus therapy is very effective, especially in vaginismus. And as the couples are here only for 2 to 3 weeks, I have made modifications to sensory focus therapy to suit their purpose so that everything is over in 13 to 14 days. Our staff are well trained in teaching the couples pelvic floor therapy. We have daily morning yoga sessions from 6:30 to 8 a.m. And my husband, Dr. Ramachandran, who is there in this audience, he is the one who guides them for the yoga and yoga nidra. The instructions given during the yoga nidra are tailored to suit the purpose for which the clients are here at the center. Systematic desensitization is particularly useful in vaginismus. Since the 6th batch, this is also being done by your staff only. Mindfulness and breathing exercises also are very important. We also offer medical support like antidepressants, anxiolytics, muscle relaxants, nutraceuticals, PDE5 inhibitors for husband as needed. CBT and other psychotherapies, yes, you all know it helps a lot. And we have a dining hall where up to 20 people can have food together. We encourage them to have food together so that group interactions are postered and they can help each other. Group sessions covering sexuality, communication, these are all our couples, communication, conflict management, allowing couples to understand each other better. Here are some pictures of positions being demonstrated with the help of male and female dolls, soul gazing and breath singing. The list is endless. And recreational activities like movie outings, dancing, etc. also helps the couple bond outside the therapy. And these are some of them. For selected cases, I do hypnotherapy and acupuncture. After the 10th day, shopping for suits, beauty parlor visit, mehendi, etc. helps build up the excitement as the consummation day draws near. Don't, please, please. Okay, so I'm getting nervous. Please stop. Just a few more slides. Okay. Towards the end of the therapy, we conduct beach therapy. Actually, this term was coined by one of a doctor couple in the third batch, They coined the term beach therapy, where the couples engage in fun relaxing activity. Not only the couples, we also engage in fun relaxing activity. This helps them to let go of anxiety. My God, the fun they have here. And can you recognize this person? Nilima. So she had come there to attend one of our group. She was there with us for 1 month, because she was not able to believe that group therapy will work in India. So we get a lot of insight from her, and her validation was very much, that is motivational for me. So here is another picture from the beach, and this is yet another. So posing for pictures, we encourage them so that they can carry back their memories. So they also make us also pose for pictures. So obviously if my husband carries me, then this bag would go. So we pose like this. So actually, it is a bonus point, because we feel that we have also started to reclaim our intimacy, which like most of us out there, we would have lost somewhere in between, So we have also started to reclaim our intimacy. Last one slide, 2 slides. We give the couples a dinner treat, and then, 1 minute. Finally, the D-Day, when the time comes for the couple to attempt penetration, some may experience performance anxiety, but we are there to guide them through. And we make sure that they are successful. And batch therapy has been a game changer for us. And we are excited of the progress we have made. And I'm sure that maybe after 1 year, I'll be able to present more data, and which will be useful for research purposes also. I'm sure Rao sir will be guiding us, because he has promised us to do so. And it has not been an easy journey. It has been a lot of challenges. But with the help of my husband, Dr. Ramachandran, and our dedicated staff, we have created something truly transformative. The staff are all very kind and compassionate. My husband started getting involved in the therapy only during the last 1 year. He coordinates everything beautifully. And now, it's not fair. All the couples love him more when they leave. So they are fans of him more than of me. Okay, so he is here in the audience. Thank you, my dear husband. I cannot do it on this slide. Thank you.
We are much extended.
Just one slide. So we now have a standard operative program, a very structured program, and this is my brainchild. The learning never ends. And this couple, yes, I'm not showing. These are logbooks, and this one does this video. Just about 10 seconds. We are going to the beach. We are going to the beach. Then a bus. This also, please take.
What time? What time? 40.